On behalf of Dr. Kathleen Grimm, who is the Director of Palliative Care at ECMC, Sandra Lauer, who is the Assistant Director of Palliative Care at ECMC, and Shelby Gaddis, who is the Head Social Worker of Palliative Care at ECMC. My name is Mark Ramos. I'm the social work intern that it works under Shelby Gaddis, the Head Social Worker at ECMC. And I'm here to talk about an innovative program, cutting-edge program regarding palliative care. Before I do that, I'd like to thank Dean Nancy Smith. I'd like to thank Diane Elsey, who is the Director of the Social Work Program. And I'd like to thank Denise Krause, who is the Assistant Dean for Community and Alumni Relations here at UP. So the cutting-edge program that I am discussing today is palliative care, providing low-income communities the ability to die with dignity. The program I'm going to discuss is new and cutting edge. It's new to Western New York. But before I do that, I'd like to give you kind of a background of what palliative care is, what the goals are, and what are the concerns surrounding palliative care to give you an idea of why we need this program in Buffalo. So palliative care is an approach that improves the quality of the patients and during long-term illness or life-threatening illness, and improves, it helps them and the families face the problem of this life-threatening illness and potential end of life, and it provides emotional and social support for them during these trying times. So some of the goals is to relieve pain from the patients, not only actual pain, but emotional pain, and help them get through it. It offers a support system for the patients and the families to cope with this life-threatening illness and possible death, end of life. It also uses a team approach to address the needs of the patients, including for social workers. One of the things that we do really well is counseling. So in this instance, it would be bereavement counseling. This would work well helping both the patient and the patient's family deal with end of life. And it enhances the quality of life during the course of this illness. Just to be sure, palliative care is not the same as hospice care. Palliative care is more long-term. It's something that could be days, weeks, months, maybe even years before the patient possibly could succumb to the end of death. It's a life-threatening illness, but it doesn't mean that they might actually end, that life may succumb for them. There may not be death in this situation, whereas hospice care is more short-term. There is an inevitability that they're going to die. It could happen within minutes, hours, days, weeks. That's the difference. Palliative care is not that. So they need more support because it is more of a longer-term situation for them. It's a longer term of care. So what are the concerns regarding palliative care? Some of the concerns are that it takes place in a hospital setting. It's very cold. There's no warmth to providing this support and providing help to these patients in a hospital setting. So our patient's concern is that many want to die at home. Unfortunately, there's not a support system to actually do that in many cases. Most of the patients need 24/7 support. They need 24/7 care, 24 hours a day, 7 days a week. Unfortunately, that's not something that most patients have at their home. Also, it's very expensive to provide equipment at their home to support the needs that they have with regards to a life-threatening illness, which eventually leads to possible end of life. So ECMC has attempted to come up with a solution to this problem. One of the solutions that we tried to establish is something that came from the West Coast. So it's in Oregon, it's in Washington, it's in California. This program would be an alternative to institutional care. So it's not something that would take place in our hospital. What it would do is it would take place at an off-site that could provide a comfort living care for patients who need palliative care. It would only be 2 people per home, and The patient care would be handled by volunteers in the community. All right? These volunteers would get training. It's called Mercy Doulas training. The training is to provide emotional and social support to these patients so they can learn to cope with this life-threatening illness, this potential end of life. It's definitely a concern for them that they need help. They need a companion. They need people who they know will be there for them through this tough time. So Mercy Doulas is to ease the dying patient's sense of isolation. That's the goal. All right? It's to provide them emotional and social support during this tough time. So, what does the UB School of Social Work have to do with any of this? Well, right now we are providing, ECMC is providing healthcare providers to assist in these comfort living sites. So that means we have physicians, we have physical therapists, we have occupational therapists, we have nurses, nurse practitioners, all at the site right now. Shelby Gaddis, who is the head of social work for palliative care, wants to create more social workers to be involved with palliative care in these sites. It's because we have an empathy, we have an understanding. We have an understanding of patients who need help during tough stretches in their life. We're there to assist them. We empower them. We work with them to feel better about themselves in situations where they may not want to feel better. We're there to help. We're there to help with the coping skills. We're there to help the family with their coping skills. The UB School of Social Work would provide an excellent support system to assist ECMC in this innovative and cutting-edge program. What we're trying to propose here is that we're trying to get the Mercy Doulas training as part of the field education program. So what would happen, what we propose is that the Mercy Doulas training is part of the field education curriculum. They'd learn the Mercy Doulas training here at UB. And then upon completion of that training, they would go to their field education site, and under their field educator would work with these patients to help them with get through their life-threatening illness and get them to possible end of life. All right. One of the things that would be is that they would demonstrate what they've learned from social work. This would be something that they could take on during their advanced years. So we want no foundation students in this situation. So would this program be beneficial for ECMC? Sure, it definitely would. How would it be beneficial for UB? All right. One of the things is that if it works out, we can have a class that trains students in this new and innovative program for palliative care. We could create this class, and it would be a one-of-a-kind class within the Western New York area. It would create more community service outlets within Western New York. It also would create more media exposure for UB, positive media exposure that would help with the UB School of Social Work program to get it out there. It would also, again, have a unique palliative care curriculum within the MSW program, and it would provide the students the opportunity and the experience to work with patients who have life-threatening illness or end-of-life concerns. So this would be really great for students who want to be a part of gerontology, which is an up-and-coming field for social workers in the social work programs. So we encourage you to take a chance to take a look at what we have and at what we proposed, and hopefully we can have a collaboration and a partnership with you guys. I'd like to thank you for your time, and I'd like to open up the panel for any questions.